everyone. Welcome back to our remote version of Open. May is Mental Health Awareness Month, and now more than ever, people's mental health is being affected due to the impact of COVID-19 and the stay at home order. And, well, many people are scared, stressed, overwhelmed, and they just don't know how to deal with this crisis. So, joining us to give us some tips on how to deal with our mental health during these uncertain times, we welcome Director, Department of Psychiatry at St. Barnabas Hospital, Psychotherapist La Shemah Williams. Hello, La Shemah.
Hi, hello. How are you?
I'm okay, dealing with the self-isolation and trying to make the most out of life nowadays in this new unrealistic reality.
Well, we may have to begin to start looking at it at a realistic reality and what our new normal can be.
I know. And so, myself, I happen to be a meditator. So, in being a disciplined meditator, I kind of feel like I am equipped with a means of being able to deal with the self-isolation. But part of the reason, aside from the fact that it is Mental Health Awareness Month, we thought it was important for us to have you on is to possibly give some insight and share, of course, your knowledge on how people can cope with these times and what type of different exercises they can utilize to just kind of get out of the funk, for lack of a better word.
It is a very, very difficult time. A lot of people are experiencing loss. For those who don't live with anyone, who live alone, they are feeling more isolated. There are different levels of social determinants that really exasperate what the sheltering in place is doing to one's emotional health and physical health. What we do encourage is that you do reach out for help with some support within the community that you live in or with family members. You can create Zoom meetings, you can create Google meetups, FaceTime meetups as a way of sort of interacting with others. You can also take walks in the parks. The parks are now beginning to open up a little bit. It's important, of course, to wear your mask, wear gloves, and continue to utilize the sanitation, the sanitizing that we encourage. But it's important to get out. It's a beautiful day outside, to get some air, get some vitamin D, walk, even if you're by yourself. When you're at home, maybe play music, decide to use a recipe. We have to become a little bit creative in order to break up the monotony, because our lives have really changed. We don't have the same options of going out into the community, taking the train, traveling to different places in the city. So we really have to use what we have to uplift ourselves. Spiritual music, if you are spiritual, you should continue to connect with your church or whatever religious organization you're with. These are just some tips in how to manage your feelings of isolation or anxiety or depression.
So can I ask you what the statistics look like now during these particular times with regards to the impact this whole crisis has had on people's mental health?
I don't have actual numbers, but this is what we can see at St. Barnabas. We are seeing an increase in relapse of substance users. We are also seeing an increase in anxiety symptoms and depression, not only with people who already may have had a diagnosis, but they are starting to have new people who are reaching out to us, because our clinic is open and operational, just as many clinics are reaching out because they're struggling with increased anxiety or new symptoms of anxiety and depression. And I think there's another significant factor that I don't hear a lot of people discussing, and that is grief, because we don't have the same opportunities to bring closure to when we lose someone. And
Right.
even if you didn't lose someone to COVID, maybe they died of another illness, the fact remains that we are not able to have funerals. We are not able to gather with family. You can't even hug your family and, cry, hug, the normal interactions and emotional support that we give each other. We're not able to do it this time. People are literally scheduling and they're scheduling how many minutes you can sit with the person that passed away at the funeral home. So these are the other factors that are impacting people's emotional health as well. So we really have to take a look at that as well in terms of grief.
So because we don't know how much longer this is going to last, before we go, can you just please share what you feel will assist anyone in finding a way to regulate their days? Because it's challenging to live, eat, sleep, and work in the same space, and school, go to school and learn in the same space, and then have the limitations of being able to go out while possibly even having sleepless nights, because I think we're all being impacted in a similar manner.
I agree with you. So as I stated before, I think that just like you would schedule your workday, you can utilize breaks in your workday to do something fun and active and creative with your family or with your spouse or with friends, whether it's through Zoom or Google Meet or Facebook, or if you're by yourself, go outside. It's okay to walk outside, take a walk around your block. You can read a book, you can meditate, you can watch. YouTube has a lot of spiritual affirmations. You can do affirmations. You have to become a little bit more creative. Try a new recipe, but you need to schedule what your day is going to be like every day and try to stick with that schedule so that you do feel uplifted and more positive every day.
Thank you. Thank you. And thank you for taking the time to share your knowledge with us. I think what I'm getting, at least, and I hope everyone else is getting, is that this is a perfect opportunity to become a lot more familiar with yourself.
Absolutely. Absolutely.
Thank you. All right, you guys, once again, for any health concerns surrounding COVID-19, you can always visit sbhny.org. All right, we do have to take a quick break, but when we return, we'll hear the latest about Bronx Week. Don't go anywhere.